Africa gets called a lot of things: backward, behind, a continent where nothing much was happening before Europeans arrived to civilize it. Here's the problem with that story. It's not true, and medicine proves it better than almost anything else. In 1879, a British medical student watched a surgery in Uganda that, at the exact same time back home, killed more than half the women who went through it. This one didn't. The mother lived. The baby lived. And the doctor was so stunned by what he'd seen, he did something strange afterward. He took the actual surgical knife home with him. That knife still exists. It's sitting in a museum in London right now. This is one of 3 times African medical knowledge wasn't just keeping up with Europe, it was ahead of it. Decades ahead, in some cases. Here's the proof most people were never taught. That student's name was Robert Felkin. He was traveling through the Bunyoro kingdom in what's now western Uganda when he was invited to witness a cesarean section. At this exact moment in European medicine, a C-section was the last resort. Something you did when the mother was probably going to die regardless, because the surgery itself was so dangerous. Mortality rates in Europe were often over 50%. What Felkin watched was a completely different level of skill. The surgeon used banana wine to sedate the patient and also used it to wash his hands and her abdomen first. That's antisepsis, cleaning the site before cutting. Europe was barely starting to accept this idea at the time. Joseph Lister was still fighting to convince British doctors antiseptic surgery even mattered. The surgeon cauterized bleeding vessels with a heated iron. He massaged the uterus by hand to help it contract, something many European surgeons were too afraid to even attempt. And he closed the wound not with thread, but with 7 polished iron pins. The woman recovered in days. Think about what that means. While British surgeons were still debating whether washing your hands mattered, surgeons in Bunyoro had already built a working surgical system: anesthesia, antisepsis, controlled bleeding, wound care, all of it, refined over generations, with no European textbook to copy from. Felkin was so shaken by what he'd seen that he wrote it all down in obsessive detail and asked to keep the surgeon's actual knife as proof. He carried it back to Britain like evidence of something he could barely believe himself. Today, that same knife is catalogued in the Science Museum in London, where you can look it up right now. That's not folklore, that's a physical object in a Western museum that Western medicine didn't have the answer to on its own. A few decades earlier, in colonial Boston, an enslaved man named Onesimus was asked a simple question by the minister who owned him. Had he ever had smallpox? His answer described a technique from his home in West Africa. Take material from a smallpox sore, scratch it into a healthy person's skin, and they'd develop a mild case and then permanent immunity. This wasn't superstition. It was an established medical practice, understood and used effectively long before anyone in Boston had an answer for smallpox at all. The minister, Cotton Mather, held on to that information. Then in 1721, smallpox tore through Boston, and it was killing people fast. Mather and a physician named Zabdiel Boylston decided to try Onesimus's method. It was explosive. Literally, someone threw a bomb through Mather's window in protest. Religious leaders said it defied God's will. This was not a quiet, welcomed idea. It was fought, violently, by the same society that needed it. They pushed forward anyway, and Boylston tracked the results patient by patient. Among people who caught smallpox naturally, about 14% died. Among those inoculated using Onesimus's method, it was closer to 2%. That tracking, comparing outcomes across a population to prove something works, is considered one of the earliest true clinical studies in Western medicine, and it only happened because one enslaved man remembered something his home country already knew. Decades before Edward Jenner ever entered the story, Boston didn't save itself. West Africa did. One case left, and this one doesn't end in the 1700s. It ends in a modern pharmacy, a plant called Rauvolfia vomitoria, found across West and Central Africa. For generations, traditional healers used its root to calm the kind of severe mental illness European medicine had almost no real treatment for, what we'd now call schizophrenia or severe manic episodes. They knew how to use it, how to dose it, and what it did, long before anyone understood the biology behind it. In the 1950s, Western researchers isolated the active compound and called it reserpine. And when a similar plant in India ran short, Western pharmaceutical companies didn't invent a substitute. They came straight to Africa's Rauvolfia vomitoria to keep the supply going. Reserpine became one of the first real breakthrough drugs in modern psychiatry, one of the first medicines that treated mental illness biologically, instead of just sedating or restraining patients in asylums. It helped start an entire shift in how the world treats mental illness. The compound behind that shift didn't come out of a laboratory. It came from a root that African healers had already understood for generations, long before anyone with a microscope showed up asking questions. 3 completely different problems: surgery, epidemic disease, mental illness, and the same pattern every single time: knowledge that already existed in Africa, doing what Europe hadn't yet figured out how to do. This isn't a story that needs exaggerating. It's documented, published, sitting in medical journals, museum catalogues, and Nobel Prize records. It just rarely makes it into the story most people are told about where medical progress actually came from. So next time somebody tells you Africa was behind, that there wasn't much happening before the rest of the world arrived, remember, there was a knife in Uganda that outperformed European surgery. There was a man in Boston who knew what to do before Europe's own hero of vaccination ever picked up a scalpel. There was a route that the modern pharmaceutical industry had to come find, because Africa already had the answer.